There are many types of medical malpractice cases. They can range from any type of provider, be that a doctor, a hospital, a psychiatrist, a nurse practitioner. Anyone in the health field who is considered a healthcare provider is subject to committing malpractice and being sued for malpractice if they fail to meet the standard of care in a case. Types of cases include failure to diagnose, for example, failure to properly run tests in order to be able to properly diagnose, failure to timely diagnose, for example, cancer case, or any type of ailment or disease that someone is suffering from. If there is a failure to properly take a history, failure to properly do a proper examination, failure to run the proper tests, all of that goes into a proper diagnosis, and if those things are not done and they're not done timely, then that's considered a failure to diagnose case. Other types of cases are failure to perform a procedure properly. If someone is to undergo an operation and the technique is poor and there is a poor outcome as a result of that, then that is a form of malpractice. If there is a failure to diagnose, for example, infection that develops into something more serious called sepsis, which is life-threatening, if not diagnosed timely, is another type of case. If someone is performing a procedure and there is a complication of the procedure, the failure to recognize that there has been a complication and or the failure to timely treat that complication, resulting in a bad outcome and harms and losses for the injured party, is another type of case. There are other types of cases, birth injury cases, where obstetrician has failed to perhaps perform a C-section timely because of the deterioration of the baby in utero, and other types of delivery problems, such as what's called dystocia, is an injury to the baby because of the type of procedures used in delivery. Failure to timely do a C-section, for example, can result in injury to the baby from loss of oxygen. So there are many, many varied types of medical malpractice cases, with the overall view that there has been a failure to live up to the standard of care in the treatment of that patient.